My name is Ralph Merante. I'm the Ryan White Case Manager at the Alliance for Positive Health, and I've been working with the HIV and Aging program for the last several months with Kris.
My name is Kris Holmes. I work as a client support specialist for the Ryan White Emerging Communities program, and I've been here over 2 years and been working for Ralph happily for the last few months with the HIV and Aging.
So you were in HIV and Aging before I was.
Yes. But you're the main facilitator.
I'm the new facilitator,
Yeah.
but I didn't start this project. You started it with Michael,
Right.
And even before that. So why don't you tell us a little bit about how this all started?
Well, this was actually, the HIV and Aging was the brainchild of Shane Roberts and Michael Kennedy, who both recognized that the population who is currently living long-term with HIV is over 50 years old. They pretty much knocked it together, presented it to the powers that be, and shortly after that we started putting it into place. We put it into action over a year ago when other agencies, including the New York State Department of Health, were still trying to figure out how to have these conversations and who to have the conversations with.
Now, some of our folks have been HIV positive for 30-some years.
Plus.
And our oldest member of the group is 80.
Yes, and our youngest member is just turned 45 a few months ago.
Yeah. So, and some have been newly diagnosed at that age, but others have been around for a long time living with the virus.
Yes.
And learning how to function. So that one of the neat things about our group has been the collaboration between the generations.
Yes. One of the things that we recognized in the beginning is the contribution that this population of people had to the population of people who were coming up behind them. Specifically, a younger generation might take advice and encouragement from an older generation, more of a parental figure. We've seen the group rally around each other, be able to be an immense amount of support even when that person didn't realize that support was available.
The pandemic and the HIV and Aging group kind of happened at the same time. And a lot of programs, the pandemic created a terrible problem and a challenge. But I think what the pandemic forced us into was a great opportunity.
Yes.
Because our people are scattered around the entire catchment basin that's served by the Alliance for Positive Health. So we have people that are down in the lower Hudson Valley counties, up here in the Albany area and far afield, some of whom don't have access to transportation on their own. And so because of the pandemic, we transitioned into Zoom meetings and phone conferences. These people have found support when they would have been totally isolated otherwise.
Absolutely.
Living with the virus and now living with the pandemic.
Absolutely. When Michael actually started putting these groups into place and actually making them into action, they were specifically all Zoom. This was post-COVID beginning, and through this entirety of the COVID pandemic, we have been able to keep the maintenance going with the clients attending these groups. A lot of times, as Ralph said, they're as far as the lower Hudson all the way up to Plattsburgh. We really don't have a limit on as far as we could go in New York State to be able to have HIV and Aging members come from, which is really a huge blessing. And as he said with the Zoom, it absolutely adds an element into their lives that wasn't there before. These are people who may suffer from social isolation due to their previous history with being discriminated, being HIV positive, that basically we've embraced an absolutely phenomenal way to be able to communicate with them and keep communicating with them. So even though they may be somewhat isolated geographically, they're not isolated support-wise.
Well, I think of that one client that we have, and that person most folks are not aware of their status. They aren't able to discuss. They're out in a very rural part of the population, don't have the transportation, and don't have the support, but every 2 weeks they Zoom in and know that the whole community is around them and listening to them, supporting them. We went through the holidays and the transition and the kind of grief around that, and really just kept buoying them up. And then they have things that they add to the rest of the group as well. So I think that one person that I'm thinking about was the group has been so essential for them to be able to thrive and survive, not only living with HIV, but now living with the compounded pandemic isolation.
Referrals generally come from inside of the agency, from other programs. Whenever we work in referrals in our programs, specifically they're generated from other members to other programs, to other program managers. Usually a necessity-based referral is what most people are used to dealing with.
Like, so people that need housing, and
right,
people need
transportation, housing, food for life, housing retention, that sort of thing. Those are all necessity programs. We're kind of an unnecessary program, but having a necessary need. So when we get a referral, the first thing that we do is talk to that person. We spend our time getting to know them, seeing how they can fit into this group where they may have not fit into another group because of their, increased isolation or location or something like that. As Ralph said, a lot of these people are still struggling with HIV identity. Is it something that they're, promoting from themselves? Are they, being very vocal about their HIV status? And a lot of people of a certain generation just don't because they're afraid. Shane Roberts, who was one of the original founders of the idea for this, had actually pointed out that, these were the pioneers, these were the leaders, these were the civil rights activists, these were the advocates before advocates became a paid position. These were the people who changed the face of this community and allow it to be what it is today. And we owe them this. We owe them so much more than this. So, as far as it can go is as far as we're going to take it.
I thought was really touching the one fellow who's one of our younger members, but who really was ignorant so much about HIV and transmission and safe practices and whatnot. I know you and our health educator were able to really...
Right. With the wonderful thing about this opportunity with the HIV and aging is that we've had so many situations that have blossomed from a simple conversation. What we're talking about is a 45-year-old man of color who had never actually gotten sex education conversation from any of his providers, from his physicians, from the case managers, anything like that. And we were able to construct a program just specifically for health education, especially sexual health education of somebody who is HIV positive, undetectable, and how that looks to the rest of the world when they're having him as a partner.
That's one of the neat things. Some of our meetings are just support meetings. The folks zoom in, we may start with a topic, but it's really not our topic, it's their topic. Yeah. So wherever the group, the members that are zooming in that day feel they need to have a conversation, that's where the conversation goes for the hour.
Yeah.
But then once a month or every other month, we do have some special speakers that come in, like that health educator. We've had someone come in, a pharmacist that comes and explain medications, interactions. We've got insurance people that are coming in to talk about the whole idea that, like, at the beginning of the epidemic, everybody was contracting the disease and were like selling their life insurance because they were going to die in the next few months. And now people are living, so what do we do? Are they insurable? Is there health insurance? Is there life insurance? How can they activate that? How can they provide for their families after they're gone years from now?
Yeah. We had one of our participants that had actually begun a chain communication with all of her children on having them chip into her death benefit. So basically, it wouldn't be this big explosive expense at the end of her life. And that was one of the conversations that kind of sparked having a speaker come in and actually explain life insurance. Because life insurance today for somebody who is HIV positive is completely different than it was for somebody who was diagnosed with AIDS back in the late 90s. Right. So, people that were flat out denied or had to rely on their communities to pay for their final expenses are now having the opportunities to plan their last moments and their last expenses and plan them in a way that it's not going to be destructive to their family element. So, which a lot of times it can be. Those get to be more than what people are used to. Yeah. One of my favorite stories has to do with Bill Farragon. When I transitioned in February 2020 and I had come to work one day, he took me aside and said that it was good that I was doing what I was doing, because being who I am, I was able to have conversations that other people were still trying to figure out how to have. Just before he passed away, I had passed him in the Albany office, and he had asked how the HIV and aging was going. And I said, it's good. We're having conversations that most people are still trying to figure out how to have. And he simply closed his eyes, smiled, and nodded his head, and it was probably one of my favorite moments that I will ever have in this agency.
One of the good things too about, I think, for the folks that join the group, they don't have to be enrolled in any other project in the agency. They don't have to meet all of the strict requirements of enrollment.
Right.
They just need to be HIV positive and over 45.
Right. We've had a good amount of referrals from outside of the agency, from people that, potentially had nothing to do with any program that's in this building. And at the bottom of the day, or at the end of the day rather, it was still embracing to them that we would have a place for them and not make them, go through the requirements that's, required for entering a program, residency verification, income verification. As Ralph said, just simply being HIV positive and over 45 years old.
And so that's certainly where we appreciate all the donations that are coming in, because we're not funded by our regular grant programs.
Yeah.
So the HIV and Aging is a service of the Alliance that really benefits from your gifts and your donations at this time to fund all of the things that we do, whether it's the food pantry work, whether it's transportation, access to insurance, intensive case management, finding homes and houses. But our program certainly really appreciates the extra and added help there.
Yeah, every bit of money that is, donated graciously to this agency pays for program services, that pays for client services, which is, at the end of the day, one of the most important things about this agency, is that at the end of the day, the client gets what they need, what they want, what they may not even realize they may have a use for. So it's phenomenal that people can take something of themselves and give it to another person and make that other person's life beneficial.
It's certainly really cool to see the folks, so many that we deal with in all of our programs, but I know in the HIV and Aging program, they have a generativity of their own. They want to help others. I see that so much with the group. They just dive in and support each other, and then work outside that box as well.
Yeah.
So I think when you support the Alliance, it's not staff and programs, it's people, neighbors that are trying to live a better, fuller life, a more healthier life, a life with better relationships, and that's kind of what we foster, and what your support and your encouragement really helps neighbors.